My name is John Leyden. I'm a doctor and a specialist cardiac anaesthetist in practice for for nearly 30 years now. And I've been involved with NECA, NeuroEndocrine Cancer Australia, or formerly the Unicorn Foundation, since 2009, its inception. Neuroendocrine cancer is the great mimicker. It mimics many common symptoms found in common diseases, such as shortness of breath and wheezing in asthma, flushing, whether it be menopausal flushing or symptoms like that, or just blushing, sweating and or excessive sweating, palpitations or racing heart rate, changes in blood pressure. But in general, most NET patients know they've got something wrong. They have a feeling of malaise often, of fatigue, and just not feeling right. So all these are common symptoms, and unless one was thinking of neuroendocrine cancers, you could ascribe them to simple diseases. Neuroendocrine cancers, depending on their location, where they form, and their spread, can be secretory and give off hormones and produce symptoms such as flushing of the skin, sweating, diarrhea, abdominal pain and cramps. And at other times, if they're not secreting, they can be silent and not show many symptoms at all. It can be dependent on what they eat, the stresses in their life, whether these symptoms are manifest. NETs are frequently misdiagnosed because their symptoms are common. The asthma-like symptoms, the flushing, the abdominal pain, the diarrhea, change in bowel habit. A lot of people get diagnosed as irritable bowel instead of NETs. They're common, so when they see their general practitioner, obviously the first common things occur commonly. And this does delay diagnosis, and understandably so, but it's only when the patients continue to represent with these symptoms, continue to represent with feelings of being unwell, that we really need to sit up and consider NETs as a differential diagnosis. And hopefully we will decrease the time of misdiagnosis, which is still in the order of 5 to 7 years, to less than 12 to 18 months. That would be wonderful. A carcinoid crisis is due to the tumours in the body secreting what we call bioactive amines or chemicals within the body that causes often very low blood pressures, racing heart, flushing, diarrhea, and can also affect the heart directly. It is important to understand this for all anaesthetists, especially those coming for large surgery, that we still cannot predict who will have a carcinoid crisis and be very unstable under anaesthesia. And we need to prepare these patients accordingly and assume that they will be unstable. And we do have treatments and we do have medications which will help manage these patients to the best of our ability, but we have to be prepared and ensure that we are assuming they will be unstable under anaesthesia. There is probably a misconception that we think if they're stable in their daily life, they're going to be stable intraoperatively. But under anaesthesia, the body performs a little differently. Even in the literature now, we know that 30 to 50% of patients will be unstable during anaesthesia and surgery. NeuroEndocrine Cancer Australia is actually the nucleus of everything to do with neuroendocrine cancers. It has done phenomenal things for NET patients in Australia. We have lobbied and advocated for treatments which are world class. We have supported patients for the last over a decade, emotionally, physically and psychologically, to understand their disease, to empower them. We have actually grown a community of surgeons, physicians, nuclear medicine doctors, endocrinologists together under the banner of NECA and neuroendocrine, and we have a vibrant and very world-class group of doctors Australia-wide who, under our auspices, now can provide exceptional care to our NETs patients. In all my years of working with NETs and neuroendocrine cancers, we still face the battle of diagnosis. And more than a decade ago, we determined the most important catchphrase was, for NETs, if you don't suspect it, you won't detect it. So education, awareness of the general community, general practitioners will improve that awareness, and if we understand what NETs can present with, we will detect it earlier and most likely have a cure.